Hello, people. Good morning, good afternoon, good evening. How are you doing today? I hope you're having fun and staying safe. Welcome to another episode of This Dev Life, where we talk developer life, challenges to face, and how we overcome the challenges every day. Today on the show with me today, I have an interesting guest joining me. As a friend, as a brother. He leads a firm that caters for healthcare services in Nigeria, well, Africa, not only Nigeria. And today, I want you to give a warm welcome to Ayodele. Ayodele, how are you doing today? Thanks for coming.
Thank you very much for having me. It's a great pleasure to be on your podcast, and really excited to talk about our work. Thank you
Yeah.
so much.
So why don't you go ahead and give us like a five-liner info about you, who you are, where you come from, what you do, what you did before now, and all that.
Interesting. So, my name is Ayodele Ademo, and I currently lead products and business at PneumaCare. Um, PneumaCare, and I mean, probably going to get into the details of PneumaCare later, but um, I'm from Ekiti State, Nigeria, and schooled in Federal University of Technology, Akure. Studied remote sensing and geographic information systems. Then after school, pretty much started work within healthcare space, and I got a job as a geospatial analyst in one of the NGOs that's focused on delivering healthcare services through technology. In Nigeria, basically in the northern part of Nigeria, to support polio work at the time, and that experience of like just gave me an opportunity to work with top organizations across board. And then from there, I moved to the World Health Organization as a global consultant, and I was responsible for at the time building a tool that was helping to help underdeveloped countries, LMICs generally, to think about adoption of new technologies and products like vaccines and vaccines delivery technologies across board. And after WHO, I decided to come back and start working on new market.
Oh, so you're like a global guy making solutions now for the local populace. I have to be
Yeah,
like you when I grow up. Oh. Yeah, right. So thanks very much for that. Now, PneumaCare, when I first heard about it, I think it was through WhatsApp chat, like this is what we're doing, and then boom, announcement, PneumaCare is launched. This is what it is and all that. Why don't you go ahead and tell our listeners a bit about PneumaCare, the services you offer, and all those nice informations just for them?
Oh yeah. So yeah, I think that's it. So I think I'm just gonna start from here. So we started PneumaCare basically at a point, I think during the COVID outbreak, and that was also based on a number of things that we've known. Like I mentioned, so my work with WHO was basically centered around the universal health coverage goal, and which was basically to help make sure that healthcare is equitable and accessible to everyone, across board. And when we looked at the infrastructure that we have within Nigeria, we also notice that there's a lot of broken systems. So we thought that how can we actually build a system that allows people to have access to quality healthcare, at a scalable rate, whilst we also able to like reduce the cost of care. Um, and I think that was actually the beginning of everything. But when we actually decided to start, I mean, we started to see a lot of other things, unfold. So how fragmented the system was, and we also saw the effort that a lot of people have also put into building those initial framework. But basically, that framework wasn't also solid. Not, and this is not their fault. It was just the fact that there was a lot of brokenness across board. So somebody is working, basically, I think one of the key things that we just noticed was the fact there was a lot of brokenness, right? I can't go into the details of who has done what and how they've decided to do the works, because I think the experiences are quite different based on our scenarios and where we stood from. So we decided to actually make healthcare, accessible through digital healthcare, for instance. So we had our telemedicine option, and we said, okay, PneumaCare was going to offer free telemedicine, but then also make quality healthcare, accessible for people through house calls. So we could, rather than you having to go to the hospital, you can actually request for a doctor to come to your house, right? But then, you can, before then, you can first of all talk to a doctor, and the doctor can tell you what to do. If there's a need for a physical examination, then, you could request for a house call. And that was basically the premise for us to start. And then, we started that and we rolled that out in November. And, we got very good traction. People started using the telemedicine offering. A number of people also started using, our house call offering as well. Sorry, are you still there, Dara? Can you hear me?
Yes, I'm right with you.
All right, fantastic. So, a number of people started using our telemedicine offering and also like our house call offering. And we also noticed that there was also a need for us to be able to like connect systems together. So when somebody goes to a laboratory and then the person goes to a pharmacy, how are we able to like connect all of this information in such a way that it's available for the care provider to also understand and make informed decisions? So that eventually led to PneumaHealth, which is now like the core infrastructure for us and which is the direction we're going. So PneumaCare is now a part of PneumaHealth, and PneumaHealth is now a healthcare data and service infrastructure, right, that provides APIs for businesses to actually bootstrap, digital healthcare services, and we can help them manage everything that has to do with the business logic, whilst they focus on just the technology and user customer acquisition.
That sounds like you're solving a huge problem and a huge service gap. Also, you're bridging it together all in one service and in one organization.
Yeah, literally. So I think one of the things we look at, we look at it as is that PneumaHealth now becomes our core, the core product that we actually give out to people, and the work we've been doing with respect to PneumaCare, being able to be that telehealth service becomes a use case, and also it becomes a service that we can we have now abstracted over an API service that people can easily just deploy telehealth capabilities, or pharmacy delivery capabilities, or laboratory connection capabilities just within the core of their products, without having to start talking to hospitals or hiring doctors, or talking to pharmaceuticals about partnerships and all that. So, and which basically oftentimes could take about 4 months before you can get those things done. So rather than having to spend 4 months before you test your hypothesis, what we're trying to do now is that we can enable you to do that, right, in just a few weeks, right, based on the amount of groundwork that we've done, right, through our partnerships, through the various engagement that we've had with like our various partners.
So I think that brings me to sort of the second to last one. I think I'll just talk about, and that's the developer integrations, which you mentioned briefly in the last point you made. Yes, you offer telehealth services, house calls, checkups, COVID tests, mental health screening, and all those kind of things. There's even live chat. I've tested it out and I know it works. The response time is within 2 minutes. Now, most of the listeners that listen to this show will most likely be developers, people who write code every day. And you mentioned that it's easy to actually bootstrap health service through an API endpoint. So developers, if you're listening to this, you don't have to worry about having to think about talking to different health organizations, pharmacies, and all the different stakeholders. Just go on PneumaCare, request an API access, and then you just get on board quickly. I don't know if you have more to say about that for our listeners, Ayodele.
Yeah, so I think you basically just talked about it, and in terms of how it's currently working. So our APIs are currently in closed beta, and we're very peculiar about use cases that people also want to try with. So I mean, and you could request, and we find your product very interesting. We would actually add you immediately, but then probably in under 1 month we should make it available for the general public to to just view their stuff on. I mean, the way it works is, so there's a problem, this problem space that internally we call we refer to it as the healthcare innovator dilemma. And the healthcare innovator dilemma for us, I mean, and was basically like, a word that, I mean, a phrase that I coined when I think about, what the kind of problems that people, face when you're coming into the healthcare space. So an example is, I being a technology person, right? I might not be a healthcare person. So which means that I lack the healthcare context. And then, but I know the technology. So it means that I need to find somebody who understands healthcare as much as possible to come on board, right? And then we can build a service. But then also within healthcare, the person, a doctor that you find would probably, as much as possible would understand, how to provide medical care.
Yeah,
But the
just that
doctor does not
specialty.
understand pretty much around, technology compliance and, technology systems in healthcare. So those layers of problems are like different, different things that people would actually face. So you can get started with building, a simple mobile app, which basically, if you look at the space right now in Nigeria, right, you see a lot of telemedicine services, right? But then you have different experiences across board, and they've not been able to provide quality care services. I don't want to say they've not been able to provide quality care services, but the patient experience on some of these platforms is actually very, very tough because of how you build the system. So you can tell clearly that this person is not a medical doctor when the person builds this service, right? And there's very limited medical interface, right, between the doctors and the patients and even the people building technology. So what we wanted to do was to build that core infrastructure that abstracts everything that has to do with the problem space, right? So we've solved this problem, right, because we have a core team of technology people, right? I've basically worked in healthcare and interfacing between technology, compliance, right, and medicine, right, which is basically talking to patients and all of that. So I'm able to bring that bit, and then we also have like other guys that are bringing their own skills together, and we've been able to like build that core infrastructure. And we felt rather than having everybody to go through a process of like building stuff for 6 months before figuring things out, right? Let us help them, build this state. I mean, we'll just have this infrastructure and we'll support you to actually test out your hypothesis and your business models, right? And you're just more focused on, getting your customers, whilst, we allow you to scale. So we're basically building up our platform to be plug and play, scalable, and as much as possible, modularized. So you can say, I just want to use this part. I don't need this other part. I just want to use this part. I don't need this other part. And you can actually have, that entire process, seamless.
No, I think that's a good one, because thinking of developing for healthcare would be a lot of, well, I don't want to say stress, but thinking about reducing the work of 6 months to about 4 to 8 weeks of integration with just calling API endpoints. I think it's a lot of, uh, should I call it disruption now on your go to market? Like, instead of having to think of going to market in 8 months, you're thinking of going to market in 4 months. That means you can beat the competition. You can get your services out to the hands of users faster. You can do a lot of things faster. If you're out there to make money, you make your money faster also. Yeah.
Yeah, that's true. That's true. I think one of the things that is also very hard is actually when you think about how do you hire quality doctors, right? That's like a big problem for most of the telehealth services because they don't want to hire full-time doctors. And also, they have to work with like external, care providers. So the question is, how do you hire quality doctors that you're sure that can provide, quality care for you? So rather than you having to do all of that process, which could take a long time, we just abstract this for you and you can go to market, like you said. So we consider it to be, trying to just help to accelerate the process of building digital healthcare products across Africa.
Okay. So if developers want to get on board right now, like a developer listens to this right now, where do they go to?
So we've created, a very small wiki page on our website, Pneuma.Care/developers. And there we had like a few use cases on how, people, even if you're not building like a digital health product, but then that you're building a product and you think, there could, adding healthcare would be something that is interesting. So for instance, we have one of our partners, who basically, does, an Airbnb kind of service, right? But then, in Africa, and what they're trying to do now is just to integrate, our telemedicine feature, right, within the core of their platform. So if you're staying in any of their apartments, you have access to talking to a doctor, free of charge. right? And that becomes, rather than them having to like go build like a new team of, doctors and all of that, right? All they just done is, integrate into our API. And, every of their, either you're a host or you are, either you're a host or you are a member in their on their platform, you have access to healthcare, and all of that is delivered through, PneumaHealth infrastructure.
And I think even with the peculiarity of the times you are in right now, well, I'm not totally sure COVID is going to hit pretty soon. So you could probably have that Airbnb service, and then as you're ordering, be like, do you want to order a COVID test alongside? When you arrive, you'll be sure to take your COVID test on this particular day, pick the date, and then
Yeah,
boom, you don't have to worry about getting extra stuff out there again.
yeah, yeah. Actually, that's true. That's actually one of the core use cases.
I think I didn't on the head with that one. Yeah. So, yeah, I think that's pretty much sums the questions I had in my head up when I was thinking of bringing on the podcast to talk about PneumaCare. Talking to developers about the services they can enjoy with it, not just them taking care of their own health, but also building services on the platform. And I'm just wondering if you have some final words to our listeners or any other points you want to make out there before we call it a wrap.
Yeah, I think one of the very interesting stuff, is that we're probably in peculiar moments, right? So, Africa generally has not seen a lot of healthcare innovation over the years. What we've seen so far and what we've seen to be very predominant or dominant in the space has been a lot of fintech solutions, right? But definitely, what we are looking at is the next few years will be a lot of healthcare revolution. So there are countries in Africa where there is actually no digital healthcare service, right? And you think about it, it's not healthcare is not like a winner takes it all kind of market, right? It's basically like everybody has specific needs and peculiar needs. So the fact that there is a telemedicine service doesn't mean that there can't be another solution for pharmacy, because at the end of the day, what the customers are the ones that make the decision. So I either buy from where I'm more comfortable with the service they're offering, I'm more comfortable with the platform and all that. And so I think a lot of people would start seeing a lot of digital health services and platforms that would actually start coming up very soon. So it's very great for people to explore opportunities within the healthcare space. And subsequently as well, when we start seeing these opportunities, I think one thing we'll notice will be that a lot of people would also start pumping money into the space the same way fintech has received a lot of funding over the years. I think that's like a personal prediction. Maybe that will happen in the next 5 years or next 7 years. No one can tell, but definitely we'll start seeing a lot of these healthcare services. And for us, we are very, very happy to work with people to build the next healthcare company to allow millions of Africans to have access to healthcare. Right. Our work basically is to support scalability, distribution, and technologies as much as possible so that we can actually reach that equitable access to healthcare for everyone. I think that would be like my set of last words. And the last thing is, last two things I want to say as well is we're definitely working as soon as we release our API platform on for public. We'll definitely be talking about what's the name, a hackathon, and that will be more focused for developers across board. And then definitely there will be cash prizes and support to ensure that they can build their products. Hopefully we can work with guys within our network as well to see how best they can support interesting ideas that they find. The other thing I would also want to mention is that, yes, subsequently we also will be looking for a lot of developers that are good with platform engineering, building services and building products. So because internally as well, we have like our core use cases that we try to leverage our platform to build. So we're always looking for very good developers to come and join our team.
All right. So where do developers go find those jobs?
Well, so currently, my email is available, Ayodele at Pneuma.Care. You could send me, an email, or you can also send an email to people at Pneuma.Care. and we definitely will see it and will respond. We will find it very interesting.
Right, all right, great. So that's it. You've heard it all from Ayodele Adeyemo on the show today. Thanks for listening up until this point, people. If this is the first time you are listening to my voice, that subscribe button is right there for you to turn it gray and then hit a thumbs up. And if you have any questions about PneumaCare, there's a partnership within this channel and PneumaCare, so I can definitely get your questions across to them. So put them in the comment section. Another thing is whatever service you book on PneumaCare, if you use the promo code Dara or Oladapo, that's DARAOLADAPO, you're sure to get 10% off. So take note of that and use it to the best. Tell your friends about it. Tell everyone about it. If you're a developer, you know someone who needs home care, PneumaCare is right there for you. And with that, I'll say till I come your way again with another guest on this Dev Live, stay safe and goodbye.
Yeah, thank you very much, Dara. Bye.
Thank you. Bye bye.